works for me. Okay, I've washed my hands. I've put on exam gloves, which we don't have, and we'll pretend I have exam gloves on. I've made my little garbage bag with a cuff, and just have this outside of your bag, okay? I'm going to show you irrigation and wiping, but this is you don't have to do both, okay? So, raise the bed, and you did your standard protocol, of course. I'm not going to show you that again because you've seen it enough. And you'd want to take the blankets down and replace them with a bath blanket, so you don't mess up their sheets, right? Okay, my hands are clean. I have the exam gloves on. And the first thing I'm going to do is take off the old dressing and measure the wound. Okay, so you're gonna pull the tape towards the wound. If it's a lot of tape, you're gonna put traction on it. You might have to use some adhesive remover. And then you're gonna remove the dressing like layer at a time. If two come off, though, I can see on here. So then you look at it. What am I looking for? Drainage. So the exudate. So color, odor, amount, odor. So it's saturated, and we're going to actually put drainage on it. So it's saturated with purulent yellow drainage with a strong odor. We were trying to decide if we could say foul odor, if that's being judgmental.
What gender do you guys
And then also that's saturated as well. So the 4x4 packing was saturated with purulent yellow drainage, and then there's 8 centimeters of purulent yellow drainage on the 4x4s that cover the packing. Then you roll it inside, get rid of it. You can change your gloves if you need to. You can put like one pair of gloves on under the other if you want. If you can, I don't like double gloving, but because my hands sweat. But that's acceptable to do. You know, so you could peel off the top layer and have clean ones underneath. Then you're going to measure your wound. If you're using a clear thing like that you're going to reuse, you don't want to touch it against the wound. So it's 13 and a half by 2 and a half. But if you have to go deep or dig around, you want to wet this with saline. This is 3 and a half. So 13 and a half by 2 and a half by 3 and a half. Okay. Then I'm ready. I'm going to irrigate first. So to irrigate, I can set this stuff aside. To irrigate, I'm going to have an emesis basin. I'm going to have a sterile syringe, so this would be in a package. And I'm going to pour my saline into a sterile urine cup. I have it ready. So I'm going to put a waterproof pad under the patient and have my lovely assistant help me turn the patient on their side. Lovely assistant. Who wants to be my lovely assistant? Who's? You can be my lovely assistant.
Oh, you're okay.
All right. So you want this close to you. When you open a sterile cup, you don't want to touch the inside. You set down the lid so it's facing up. I'm going to pour saline in there. And I'm going to irrigate the wound, 3-4 times till it runs clear. Take the curved side of the emesis basin and put it against the wound.
All right, my lovely assistant here.
Okay, wait.
So that looks good. So we can roll them back down.
No, I screwed up.
And then I would throw that, that syringe can go away. Okay. Then I would pat this dry so the edges don't get emaciated, and then I macerated, and then I would and then I would do the packing. But I wanna show you the cleaning with the, if you're using your dressing change kit and are supposed to wipe the wound with a saline gauze, I'll show you how to do that.
Yes, a little, the urine cup, yeah.
Taking off the dressing, measuring it are all the same. Can I use your kit? Is this your kit? Okay. So don't tear your don't tear it off completely because it's too hard to repack then. And this you can just, I would keep this separate, keep this separate. You know, this, you'd use this for your bag. You're not going to use the force, you just won't have forceps to use. Sometimes I'll open a suture removal kit if I really need a pair of forceps and a sterile scissors. I'll open a sterile suture removal kit, and I use that for the string gauze so that I have a sterile scissors and I have a sterile forceps to hold that string gauze, you know, the new gauze. I'm going to just set that aside for now.
Is that the gauze for the tunneling?
Yeah, the gauze for if you have tunneling.
Yeah.
Yeah, that new gauze, because you always leave an edge of that hang out, and then you have to cut that edge that's been hanging out in the air. You know, you have to cut that off. So you pick it up with a sterile forceps and cut the edge that's been hanging out, and then you start tucking it in with a sterile Q-tip, holding it with a sterile forceps. Okay, so then on here, you're going to pick the drape up by the back, and just, you can lay it out this way, or you can lay it out the long way, whichever feels right to you. Remember, if you're laying it out this way, the part that hangs over the edge, isn't sterile, right? And of course, if my badge touched, this is no longer sterile. Or if your you gotta watch your stethoscope, watch your badge, watch things. When you pick up the box, you don't want to touch the edge because the equipment might fall over there, so you want to hold it from the bottom and just dump it onto your tray. Then you're going to pour your saline in there. We'll pretend this is my saline. Pour your saline in there. And the saline, you date time initial the saline, and then you're going to I handed out extra 4x4s the other day. You'll need about, if you're wiping, you'll need 1, 2, 3.
You need at least 6.
5, about 6. Is that what you figured? Yeah. Okay. Okay, so we'll just put this here. Then I'm going to, that's all sterile that came out of the kit. Then I'm going to put on my sterile gloves. See? I put on my sterile gloves. Then I'm going to get my equipment ready. I've got saline in there. I'm going to have the dressing for packing. I'm going to unfold and have that on the bottom. And then I'm going to have some dressings to turn into wontons for the top. And you can, on this one you really, because it's so narrow, I could probably just do one swipe. You know, if it were a big gaping wound, I might want to do one swipe down each side and down the middle. And it depends on how dirty the wound is too, but I think I'll just do one. And then I'm going to, so then I'll have enough dressings. And then I need some to clean the edges and to pat dry. Okay. So then I'm going to have a sterile hand and a clean hand. My sterile hand picks up the stuff, my clean hand does the actual cleaning, right? So, okay, so I'm going to pick up my gauze, transfer it to my clean hand, and I'm going to clean the far side of the wound in the middle. I'm going to go from top to bottom, and I'm going to do it gently. I don't want to damage that newly epithelialized tissue. Throw it out, and then I'm going to do that again with another one. And you can do side, down the middle. This one isn't that deep, so probably just side and side is fine. So I'm going to gently clean that, throw it out, and I'm going to clean the skin. throw it out, clean the skin, throw it out. And you might want to clean the skin, like I could do this, I could move away from the wound. I could clean the skin here and I could clean it here too, couldn't I? Because the area under the dressing isn't getting washed. So that would be acceptable to do this. Now some nurses will clean like this, you know, they'll take a new gauze each time and clean like this. And that's acceptable too, but usually a clean procedure is okay. So if you go from here to here, you're taking the bacteria and you're getting rid of it. You don't want to do this, because then you're just kind of spreading it around. Okay, so you do each side of the wound, throw it out, and then you're going to pat it dry, pat, 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 take another one, pat, 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 so that my edges don't get macerated, and then I'm ready to pack. I'm going to pick up my sterile Q-tip, which isn't there, so pack your box so that the sterile Q-tip is in your kit. Just make it easier. Okay. So I'm going to pick up my sterile Q-tip with my sterile hand, and I'm going to hold it in my clean hand, and I'm going to take my gauze and crunch it up in my hand, and then I'm going to tuck it into the wound, and I'm going to, I want to keep the wound surfaces moist. I want to try to keep the dressing from touching this outside edge though, because that's not as clean. The thing I want the cleanest is the inside of the wound, right? And of course when this is wet, it's going to pack tighter. I probably need 2 of them. So tuck it into the wound so that the wound heals from the bottom up and from the sides to the middle, and all surfaces are covered. And I'd probably need another maybe smaller one. If it was wet, I'd probably need 2 for it, of course. But for your checkoff, if you just put 1 in so that we know that you have the idea, you're fine. Because the wet to moist aren't used that often anymore anyway. Okay, so then then I'm really done. That was really the part that I needed to be the most sterile, right? But I can just take dressings. Whenever you pick up a dressing, even if you're just wearing exam gloves, pick them up so that you're touching the back of the dressing, so the part that goes against the wound is, the sterile part goes against the wound, right? And then I'm going to take my ABD and I'm going to tape it like a window box. I'm going to put a piece of tape on there with my date, time, and initials. If you have a Sharpie, you know, still put a piece of tape on. If you have a Sharpie, you could write on the patient. If you're using a ballpoint pen, I wouldn't write on the patient. I would probably write on the, write on the tape here and then peel that off and stick it on. And sometimes you even get like a little label inside the dressing package. So, and then just clean up your mess and document. And we will create,